So you've got to transport, in maybe interfacility. Let's talk about some advanced equipment, or just maybe not advanced equipment, but maybe some equipment outside your kind of normal realm of understanding. Let's talk about this stuff real quick. First, let's talk about chest tubes. So something we're not going to be putting in place in the field, but maybe in the hospital. There it is, just a big old tube in the side of the chest. So just like our needle decompressions on the anterior chest, this is a pleural decompression on the side of the chest, just a very large tube. So tube goes in on the side of the chest, removes air, removes fluid from that pleural space. This is not a needle decompression, right? This is not a needle thoracostomy. This is a tube thoracostomy. Requires a surgical procedure in the hospital. So we can either place it superiorly or inferiorly, depending on if we want to get air out, if we want to get fluid out. Your chest tube is going to be hooked up to a drainage canister. It's going to look something like this. So you've got this canister, and you'll have this piece going up to the chest tube itself and draining into this canister. So if we are for draining fluid, draining blood, we can measure how much fluid we've drained into this canister, and that's really important to document during our patient transport. There are going to be a few chambers in our drainage canister. There's going to be a fluid chamber, there's going to be a water seal, and then there's going to be some sort of suction control. We can either hook it up to suction, or we can just what we call hook it up to gravity. We can just put it down below the patient, the level of the patient, and let gravity do its thing. We want this canister to stay upright. So you see there are some little legs on this thing. We want this thing to stay upright at all times, even during transport, right? So we're going to keep this at below the level of the patient, even if it's just suction driven. Most of them are gravity driven, so we're going to keep them below the level of the patient. We're going to keep it upright. So how do we keep this upright during transport? Well, this little leg right here, put that right next to, or put this drainage canister right next to your stretcher in the ambulance. And what I have always done is extend these little legs right here and tape the heck of them down to the floor of the ambulance. We want that drainage canister to remain upright. We don't want to break that water seal. Keep it upright. We want to know exactly how much fluid is coming out. So we're going to keep it upright. And we're going to keep it below the level of our patient to help to let gravity do its thing. Next is our intra-aortic balloon pump. This is a little bit more complicated than a chest tube, right? So our intra-aortic balloon pump, the machine's going to look something like this in the hospital. It's going to be attached to the patient. It's not going to be able to go very far from the patient, even just maybe like 4 or 5 feet from the patient. Patient's going to be hooked into this thing at all times. You're going to have a special setup in your truck to transport these things, but they're very important to know about. Intra-aortic balloon pumps, or we just call them balloon pumps, are what's known as a bridging device. So these are short-term devices for patients. They're awaiting heart transplants. A lot of these patients are awaiting heart transplants, or just they've had a CABG, they've had an open heart surgery, and they just need a couple days to let their heart recover from that surgery. So these are short-term devices. They're in the hospital only. You're not sending a patient home on a balloon pump. So no more than just a couple weeks on these devices. There is a balloon that is inserted and placed in the descending aorta, right below the aortic arch. It's a helium balloon that inflates and deflates with every heartbeat, and it's what we call a counterpulsation device. And there's a whole video here that will explain that a lot better than I will ever be able to. So a really good video for you to watch. It's a counterpulsation device, and what that says is that the balloon inflates during diastole. Right? It deflates during systole, inflates during diastole. So what that does is, here's our normal arterial curve with its little dichrotic notch there, you can see. And if I inflate it during diastole, I'm pushing blood back into the heart, towards the heart, but the aortic valve is closed, so it pushes blood in the coronary arteries and supplies the heart with a little extra oxygenated blood, helps the heart along. And when it deflates during systole, it actually decreases the pressure within the aorta, right? So it decreases systolic pressure. So, like I said, there's a whole video there for you to watch that explains this instead of me sitting here and explaining it to you and you having to listen to my voice only. There's also some better visuals there for you. But this counterpulsation device helps both coronary artery flow and helps lower lower blood pressure, lower kind of myocardial workload. So, in an ailing heart, whether they're waiting for a heart transplant or just coming out of heart surgery, this can really do a lot of good for our patients. You'll also encounter patients just out in their homes, just out on 911 calls on ventricular assist devices. These assist devices are temporary. Again, they're not meant for long-term use, right? They are temporary, and these patients are again waiting heart transplants, waiting to go into heart surgery, awaiting stent placements, things like that to keep their heart going and just kind of reduce cardiac workload in the temporary sense. So these assist devices are left ventricular assist devices. So again, used in patients awaiting transplant, waiting open heart surgery. They've got unstable, very unstable coronary artery disease. These devices have an external battery. Please don't take that battery out, right? Be mindful of that battery. And they have a continuous flow. Most of these devices, at least the newer generations, have a continuous flow, which means your patient isn't going to have a pulse anywhere. They're walking around, they're pink, warm, and dry, they're just fine. You go to take their pulse, you're like, I don't feel a pulse. Well, it's because they don't have a pulse. We have a continuous flow through the left ventricle, and that doesn't produce a pulse. So here we have one of those left ventricular assist devices, an LVAD. So it's taking blood from the left ventricle, pumps it into this LVAD. This is this pump. This is continuously flowing, and it pumps it into the aorta, right? So the heart itself doesn't actually have to really do a whole lot, right? The left ventricle doesn't have to do a whole lot. It takes blood from the left ventricle, pumps it through this LVAD pump, which is continuous into the aorta. Again, there's an external battery. There's some sort of control unit. So this is externally controlled, and we have to be cognizant of those batteries, but just know that your patient is not going to have a pulse. A newer generation implantable device, similar to the LVAD, the left ventricular assist device, is the Impella heart pump. This is still implanted in the left ventricle, so it's still helping the left ventricle along. It's for a little bit more stable coronary artery diseases, not the kind of end of the road CADs, but we're still flowing blood into the aorta, so it's implanted there in the left ventricle. There's a little bit of an intake right there and shoots it into the aorta. So a little bit different than the LVAD. The functionality is pretty similar. Again, kind of pulseless patient, which seems a little weird, but we still have that continuous flow. It's just in a different manner. If you have any questions, concerns, comments, cuss words, please let me know.